All right, let's get right into it. We're going to talk about something you probably do every single day, a simple habit that, if you're not careful, could be silently putting you at risk for a stroke. Think about this for a second. Have you ever stepped out of a hot shower or a warm bath, and for a moment you felt dizzy? Maybe your heart was pounding a bit? You probably just shook it off, right? Well, what if that feeling was actually a warning sign? Now, here's a number that really made me stop and think. Medical research is showing that almost 40%, that's 40, of strokes in people over 65 happen during or right after totally normal, everyday activities. And guess what one of the biggest, most overlooked triggers is? Bathing. So first up, we're going to pull back the curtain on the hidden dangers lurking in your bathroom routine. We're going to walk through 7 common habits, all based on real-life medical cases, that can turn this relaxing daily ritual into a serious medical emergency. Let's kick things off with the most obvious factor, but maybe not in the way you think: temperature. You see, it's not just about what feels comfortable. It can actually be a trap for your entire cardiovascular system. So, dangerous habit number 1 is bathing late at night, especially when the bathroom itself is chilly. Let me tell you about Robert, a 70-year-old teacher. For 15 years, he had the same routine: a bath around 11:30 at night in his drafty, poorly heated bathroom. Well, one cold evening, he stepped out of the tub, felt a wave of dizziness, and collapsed. He'd had a stroke. The doctors in the ER, they called it a perfect storm. See, the cold air made his blood vessels clamp down, which sent his blood pressure soaring. And this was happening at the exact time of night when his body was naturally trying to lower his blood pressure to get ready for sleep. So it's that combination that's just so incredibly dangerous. Okay, so what's the fix? It's actually pretty simple. First, try to get your bath or shower done at least 2 hours before you plan on hitting the sack. Second, make sure the bathroom is warmed up to a comfortable temperature. Somewhere around 70 to 75 degrees Fahrenheit. And maybe the most important thing of all, if you start to feel dizzy or your heart feels like it's racing, stop. Just stop. That's your body screaming a warning at you. Now, the room temperature is one thing, but the water temperature, that's a whole other story. The two extremes, hot and cold, do completely opposite things to your body. Cold water causes vasoconstriction. That's a fancy word for your blood vessels rapidly getting super narrow. And really hot water, that causes vasodilation, a dramatic expansion. Both of these sudden changes can put a massive strain on your system. And this brings us right to our next 2 dangerous habits. You've got shocking your system with ice-cold water on one side, which actually sent a 70-year-old man named David to the hospital with a massive stroke. And on the other side, you've got soaking for way too long in scalding hot water. This caused a woman named Margaret to nearly pass out from a sudden, dangerous drop in her blood pressure. So, what do? We find the Goldilocks zone. You want to aim for warm water, not hot, not cold. The ideal range is somewhere between 98 and 102 degrees Fahrenheit. And you've got to limit your time, 10 to 15 minutes max. Seriously, set a timer on your phone. And if you have any pre-existing heart conditions, just avoid the cold water altogether. It's not worth the risk. All right, so we've talked about temperature, but beyond that, it is absolutely crucial to listen to your own body. There are some serious warning signs that can tell you, hey, now is not the right time to get in the shower. Habit number 4, and this one is so common: bathing while you're dehydrated. As we get older, our sense of thirst can really diminish, so we don't even realize it's happening. Take Eleanor, a 68-year-old who admitted she rarely drank enough water. One morning in the shower, she got so dizzy she had to sit right down on the floor, totally confused and unable to even speak clearly. Here's the scary science behind it. When you're dehydrated, your blood literally gets thicker, it's stickier. This makes it way harder for your heart to pump it around your body. And that dramatically increases the risk of a clot forming, especially in the warm, humid environment of a shower. The solution for this one is, frankly, non-negotiable. You have to drink a full 8-ounce glass of water 15 to 20 minutes before you even think about getting in the shower. And that timing is everything. It gives your body just enough time to absorb the fluid and get your blood flowing smoothly. Okay, habit number 5 is one I think we've all been guilty of: forcing yourself to take a shower when you already feel kind of crummy, maybe a little dizzy, a headache, just off. Patricia, who is 65, thought a warm bath would make her headache feel better. But instead, the stress on her already struggling system actually triggered a mild stroke right there in the bathtub. This quote just says it all, doesn't it? Dizziness, an unusual headache, these are like your body's check engine light. They're warning signs that the blood flow to your brain might not be right. So postpone the shower. Your hygiene can wait a few hours. Your life can't. And finally, let's talk about timing, because what you do right before you get in the shower can be every bit as important as what you do in the shower itself. I know. It seems so logical to jump right in the shower after a workout, but it can be really dangerous. After you exercise, your blood vessels are already wide open or dilated, trying to cool your body down. A hot shower can make them expand even more, which can cause a sudden, really severe drop in blood pressure. And that can literally starve your brain of oxygen. And here's our last one, habit number 7, bathing right after you've eaten a big meal or taken your medication. A man named William, 65, did this every single day. He'd have a big lunch, take his blood pressure pills, and hop straight into the shower. He basically created his own personal perfect storm that caused a stroke, and it left him with permanent weakness in his arm. Here's the deal. After a big meal, your body sends a huge amount of your blood, up to 30% of it, to your stomach and intestines to handle digestion. So if you take a warm shower at the same time, you create this battle for blood flow. Your digestive system wants it, and the shower is pulling it to your skin. And in that battle, guess who loses? Your brain. The fix here is just a little bit of patience. That's it. Wait about 15 to 20 minutes after you exercise, and after a big meal, give it a full 30 to 60 minutes before you bathe. Just let your body do its thing and stabilize first. Wow, okay, so we have covered a lot of ground. Let's pull this all together into a simple, easy-to-remember safe bathing plan. Here it is, your safe bathing checklist. First, check your environment. Bathe a bit earlier in the evening and make sure that room is warm. Second, check the water. Keep it warm, not hot or cold, and keep it under 15 minutes. Third, check your body. Drink that glass of water 20 minutes before, and hey, if you feel sick, just wait. Finally, check your timing. Always wait after exercise and always wait after a big meal. You know, these little changes can make a massive, life-saving difference. A lot of strokes are preventable, especially the ones triggered by these simple daily routines. So I have a question for you. Looking at this list, which one of these 7 habits are you going to commit to changing, starting today?